This lecture will focus on trypanosomiasis, or sleeping sickness, a disease that plagues certain parts of Africa. Since the start of the 20th century, and probably long before then, African communities have known that the tsetse fly was dangerous. They knew the bite of the fly caused a deadly disease both in humans and animals. To keep their herds and their people healthy, they avoided any area where tsetse fly populations were high. At first, the cause of the disease was unknown, or just assumed to be the fly, but the brains of two patients examined during autopsy provided some answers. In 1899, a surgeon by the name of F.W. Mott described infiltrations of mononuclears in the perivascular space of brain vessels. There were also large abnormal plasma cells, which were later named after Mott himself. Still, the cause of the disease was unknown. Years later, it was discovered that sleeping sickness was caused by the infection of trypanosomes. The parasites were discovered in the blood of someone suffering from the disease. So, Trypanosoma brucei gambiense was discovered as the cause of sleeping sickness, and its close relative, Trypanosoma brucei rhodesiense, which is carried by the tsetse fly, also caused the disease. While the tsetse fly was originally believed to be the cause, it was just the vector, carrying the parasitic protozoa and transmitting it through its bite. Tsetse flies need to feed on blood to survive, and they have a voracious appetite, feeding almost every day. A tiny insect in the same family as the common housefly has inhibited the settlement of Africans in large areas where agriculture has the potential to flourish. Many methods have been tested to attempt to bring the tsetse fly populations under control. Most notably, treating the flies with gamma radiation renders them sterile, but it does not inhibit their ability to mate. Female tsetse flies are only able to mate once in their lifetimes, so if they mate with a sterile male, no offspring will be produced, effectively rendering that female sterile. The photos provided on this slide show the tsetse fly vector as well as the parasite responsible for infection. Sleeping sickness affects its victims in two stages, the hemolymphatic stage and the meningioencephalitic stage. Initially, those infected will have intermittent fevers, headaches, muscle and joint pain, and inflammation in the lymph nodes. The second stage surfaces at different times depending on the infecting protozoa. Those infected by Trypanosoma brucei gambiense will experience the second stage within 1 to 2 years, while those infected by its subspecies carried by the tsetse fly will develop the second stage symptoms within several weeks. These timelines are in conjuncture with the invasion of the brain and spinal cord. Typical neurological complications like paralysis and tremors arise with invasion, and if left untreated, the infection can lead to coma and death. Toxemia, or the presence of toxins in the blood, can also be a major cause of death in those infected by the flies subspecies of the parasite. The photos on this slide show the damage done to the brain during infections. West African trypanosomiasis corresponds to infection by the Gambian strain of the parasite, while the more severe East African or Rhodesian form of the disease is caused by the Rhodesian subspecies. The parasites responsible for the disease don't just affect humans, however. Many wild animals were killed if they were believed to be hosts. The tsetse fly isn't a picky eater, but unfortunately humans were added to the mix. The chart on this slide shows the number of reported cases of trypanosomiasis from 1926 to 2000. As you can see, the numbers have steadily been rising since 1965. Trypanosomiasis is quite difficult to treat. The most important factor is catching and treating the disease as early as possible. Earlier treatment leads to better chances for recovery. There are 4 main drugs used to treat the disease, and sometimes a 5th is administered in combination with one of these. Each of the drugs can only be used during certain stages of the disease. For the West African type, eflornithine, or the alternative pentamidine, is effective for early stages of the disease. When the central nervous system becomes involved, eflornithine is still shown to have a positive effect because of its ability to pass through the blood-brain barrier. Additionally, combining eflornithine and nifurtimox has shown promising results for the West African infection. For the more serious East African form, suramin has effectiveness in the early stages. The drug for the latter stages is highly toxic. It is an organoarsenic compound called melarsoprol. Unfortunately, once toxemia sets in, all forms of treatment are rendered completely useless.